Hi, my dear students. You're welcome to Muhumuza Naphtali medicalsciences.com here in Uganda, serving you at the comfort of your home. As we are in a series of enzymology, always remember to subscribe and share your comments. Today we want to talk about application of enzymes in medicine. And please, if you haven't watched a video on introduction to enzymology and factors affecting rate of enzyme activity, first watch them so that you are able to understand this. Let us get started. So we are talking about how are the enzymes important in medicine. In the hospitals where we are working, how can we apply these enzymes to come up with clear diagnosis of diseases in our patients? As we know that these enzymes are produced in the tissue or living cells, we want to see how are we applying them in medicine. And they are majorly applied in the three areas of medicine. That is in laboratory diagnosis, as analytical reagents, and also as treatment of diseases. Those are the major three areas where we apply our enzymes. So we are saying these enzymes are applied in three areas, that is in diagnosis of diseases. We are applying them as analytical reagents, whereby in laboratory people are using these enzymes as analytical reagents, especially ELISA or immunoassays, to come up with diagnosis of diseases. Then lastly, we shall look at how they are applied in therapeutic use by the pharmacists. How do we use these enzymes to treat some diseases? Therapeutic use, what we call treatment of diseases. So these are the three areas we are going to discuss about today. And make sure you watch this video until the end so that you may benefit. So we want to begin with diagnosis of diseases. How do we apply enzymes in diagnosis of diseases? As we know, we have different enzymes, and some of the enzymes we have ALT. We have enzymes like ALT. Let me use another different marker. We have enzymes like ALT. We have enzymes like AST. This is alanine aminotransferase. This is aspartate aminotransferase. So these enzymes, we are applying them in treatment of diseases in our medicine. For example, ALT, which is formerly known as SGPT, you can call it serum glutamate pyruvate transaminase. And AST, which was formerly known as SGOT, serum glutamate oxaloacetate transaminases. So these enzymes, they are being applied in the laboratory in diagnosis of liver diseases. And especially whenever we find ALT and AST, all of them elevated. When all of them are high, here we suspect a condition known as hepatocellular damage. And there are many causes of hepatocellular damage. This hepatocellular damage, or the destruction of the liver hepatocytes, can be due to viral infection, it can be due to a viral infection, it can be due to toxins, it can be due to drugs, or it can be autoimmune, or it can be blockage, whereby you block the blood supply. And whenever you block the blood supply into the liver, we see ischemia coming in and necrosis, which can lead also to damage of the liver hepatocytes. So whenever we do alanine aminotransferase, we do aspartate aminotransferase, and all of them are elevated, we suspect hepatocellular, any condition that causes hepatocellular damage. Either it can be viral, it can be toxins, it can be drugs, it can be autoimmune, or blockage of the blood supply. But when we assay ALT in the lab and AST, and we find ALT is high, we find ALT is normal and AST is high, this one, it confirms us, because we know that alanine aminotransferase is specific, is liver specific, whereas AST is non-liver specific. Why? Because AST is produced by the cardiac, is produced by the liver, is produced by the skeletal muscles in equal proportions. We find AST being produced in the cardiac, in the liver, and in the skeletal muscles in equal proportions. And to the smaller extent, they're also produced in the kidney and the pancreas. So making it non-specific. So whenever I do AST is high and ALT is normal, I don't suspect any condition of the liver. Because if the liver was damaged, even ALT would be high. So since it is normal, we now suspect a cause. Either this condition might be due to myocardial infarction, that is heart attack, or it might be skeletal muscle dystrophy or disorders, or it can be due to major cardiac or even renal failure, because we saw that even it is also produced by the kidney. AST is also produced by the kidney. So we find it, do ALT is normal and AST is high, we suspect myocardial infarction, skeletal muscle disorders, and renal failure, other than hepatocellular damage, because we are seeing ALT is normal. But when you are in the laboratory and you do ALT and it is high and AST it is normal, don't rush to sign out these results, because we know that all these enzymes are produced by the liver cells, and we expect them, the moment we see ALT high, we expect also AST to be high. Because ALT is liver specific, we know that there is a problem with the liver cell damage. And then the question is, why is AST remaining normal? It might be due to any other error or any cause. Maybe your machine is not calibrated, or the reagents are expired, so you have pipetted wrong volumes. So before you sign out to these results, always first check to ascertain what is causing elevated ALT. And I normally tell you that to come up with the diagnosis to tell someone that he has a liver problem or any other disease, these enzymes should be at least 2 times the upper limit. 2 times the upper limit. Isn't it? So that is how we can diagnose using ALT and AST. Other enzymes which we use in the laboratory in diagnosis of diseases, we see enzymes like GGT. GGT is known as gamma glutamine transferase. Then we have another enzyme known as ALP, which is alkaline phosphatase. We have another enzyme which is known as 5' nucleotidase. 5' nucleotidase. So these 3 enzymes are also being used in the diagnosis of hepatobiliary obstruction diseases. Because when we draw the liver, as we know that the liver, if this is the liver, it is divided into 2. We have the right hepatic and the left hepatic joining into the common hepatic. Then this one joins to the gallbladder. This is the gallbladder, then it joins into the duodenum. So these enzymes are produced by the lining of the biliary tree. We find them within the biliary system. So any problem, any damage, any obstruction of these biliary linings, or what we call epithelial linings of the biliary system, we can find the GGT being high, ALP being high, and 5' nucleotidase being high. So these ones are high whenever we find any problem causing what we call hepatocellular damage, hepatobiliary obstruction. Any condition that leads to obstruction of the biliary system causes elevated GGT, ALP, and 5' nucleotidase. And what are those conditions which cause hepatobiliary diseases? We have guys like cholestasis, which is the complete blockage of the bile duct. We have cholecystitis. We have cholangitis, primary sclerosing cholangitis. We have gallstone, which we know which is known as cholelithiasis. We have other conditions like cancer of the gallbladder. We have pancreatitis. All these conditions can cause hepatobiliary obstruction. So whenever you have any hepatobiliary obstruction, any condition that is affecting the flow of the bile within the biliary system can cause all these three enzymes elevated. However, among the three, we know that only 5' nucleotidase is specific to the biliary system. 5' nucleotidase is the only enzyme that is specific to the biliary system. Why? Because other enzymes like GGT, if I can zoom them here, I can write them here. We see GGT. GGT is produced, except the biliary system, is also produced by the placenta. GGT is produced by the prostate or the testicles, or you can even say prostate. Is produced by the kidney. Is produced by the pancreas. So meaning this enzyme is not specific to the liver, compared to 5' nucleotidase, which is only produced by the biliary system. So you can find the GGT elevated in other conditions like testicular cancer, other conditions like renal failure, and other conditions like pancreatitis. You find GGT also elevated. And also not forgetting people who take alcohol. Whenever a condition known as chronic alcoholism, whereby every day you take, that is chronic alcoholism, you find it can cause GGT to be elevated. And also metastatic cancer. Metastatic cancers which have, especially cancer like breast cancer, colon cancer, and cancer of the pancreas, they normally invade the liver. So we can find them elevated because of this metastatic cancer. And finally, people on treatment of drugs like TB drugs like rifampicin, drugs, those who are having conversion disorders whereby they are on barbiturates like phenytoin and phenobarbital can also cause elevated GGT. So making it non-biliary specific compared to 5' nucleotidase. Then ALP, alkaline phosphatase, for it is found in the placenta, is found in the liver, biliary system, is found in the bones, major in the bones, and we find this liver ALP also in the kidney. So other conditions except the biliary system, for example, pregnancy. Pregnancy can lead to elevated ALP. Bones, this is in growing children. Growing children can have elevated ALP. Also, We can see it elevated in Paget's disease. Paget's disease, this is the disease of the bones. We can also see it elevated in bone cancer. Then even renal failure. So making these two enzymes non-biliary system specific compared to 5' nucleotidase, which is solely produced by the biliary system. And this is how we are using these enzymes in diagnosis of diseases. Then other enzymes we can look at in diagnostics. Can look at other enzymes like creatine kinase, which is abbreviated as CK. We are going also to see another enzyme like lactate dehydrogenase. And these enzymes have different isoenzymes. Isoenzymes are different forms of the same enzyme. You find one enzyme having different forms, and they are named according to the tissues where they are found. So you find CK, we have what we call CKBB, there is creatine kinase MM and creatine kinase MB, whereby BB is found in the brain, MM is found in skeletal muscles, then B is found in cardiac, or what we call heart muscles. So when I do an assay in the laboratory, these different isoenzymes are separated by the process known as electrophoresis, because they move according to the density. So when after being separated, and we find someone has CKMB elevated, this one I suspect myocardial infarction, that is heart attack. And whenever someone has CKMM elevated, I suspect muscle disorders like dystrophy, muscular dystrophy, or muscle disorders. And whenever someone has CKBB elevated, I suspect any neural injury or brain defect, any brain injury to the brain. Because we know that these enzymes are found in living tissue or cells, not in the blood saturation. So whenever they are high in blood saturation, it means there is injury or necrosis which is occurring in these tissues, and then they are spilling them over into blood saturation. So that's how we can suspect those things. So we can use creatine kinase to diagnose brain injuries. We can use it to diagnose muscular disorders. And also we can use it to diagnose cardiac problems like heart attack, what we call myocardial infarction. That is how we can apply creatine kinase. Then lastly is LDH, what we call lactate dehydrogenase. Lactate dehydrogenase, this one has 5 isoenzymes, whereby we have LDH1, LDH2, LDH3, LDH4, and LDH5. Whereby LDH1 is specific to cardiac, LDH2 is specific to RBCs, LDH3 is found majorly in lungs and kidney, even 4 is found in lungs and skeletal muscles, then 5 is found in the liver. It's found in the liver, and a smaller extent skeletal muscles, but majorly the liver cells. So when I do these different isoenzymes in the laboratory, and I find LDH1 is the one which is elevated, then I can suspect a myocardial infarction, or what we call a heart attack. This one can be due to myocardial infarction, or any problem with the heart can lead to elevated LDH1. Then LDH2 being red cell specific, we find conditions like leukemias, and any cause of hemolysis of these red cells can lead to elevated LDH. Leukemias and anything that causes hemolysis, because it is RBC specific. Then any disease of the lung and the kidney, we find LDH3 elevated, like kidney failure or any disease that affects lungs, we can find elevated. Then finally, we look at if we also have 4, and 4 is also specific to the lung and skeletal muscles, then 5 is the one that is specific to the liver. So any problem with the liver, any disease that is affecting the liver, LDH5 is also elevated. So whenever I do LDH5 and I find it is super high, then I can suspect any disease of the liver. Either liver necrosis, hepatitis, anything that causes hepatocellular damage. That's why I can. Then lastly, there is another enzyme called acid phosphatase. Acid phosphatase enzyme. This acid phosphatase enzyme is specific to the prostate, and we normally use it to screen for prostate cancer. Acid phosphatase is another enzyme that we can use in diagnosis of prostate cancer. So this is how we can apply enzymes in diagnosis of different diseases in the lab. So we can go to application number 2, which is application of enzymes in as analytical reagents. How do we use them in the laboratory as reagents? Whereby number 2 is as analytical reagents. And we say these enzymes, they are used especially in immunoassays. Immunoassays. We use them in immunoassays, especially ELISA, in ELISA methods. Whereby ELISA we have competitive, non-competitive, and sandwich. And in ELISA, we are applying enzymes like the most applicable one is horseradish peroxidase. Horseradish peroxidase, which we abbreviate it as HRP. It is the most commonly used. But if we don't have HRP, we can also use RALP, which is alkaline phosphatase. We can use enzyme like beta glucosidase. These enzymes are majorly being used in immunoassays, that is in ELISA. ELISA, which stands for enzyme-linked immunosorbent assays. We are using them in the diagnosis of HIV. All serological tests, we can do them with ELISAs. And in ELISAs, we are using these enzymes as markers. We get an antibody or an antigen, depending on the type of the ELISA, and we tag it on the antibody. That's why we call it enzyme-linked. We link an enzyme so that we can easily visualize it by measuring how much it is breaking down the substrate. So that's how we are applying enzymes as analytical reagents. Apart from being in immunoassays, we see reagents used like urease, enzyme like urease in bathrotes, determining the levels of urea in blood. We can do urease. We see using enzymes like cholesterol esterase and cholesterol oxidase in determination of total cholesterol. We use enzymes like glycerokinase in diagnosis of triglycerides in the lab. We are using enzymes like uricase in diagnosis or measuring uric acid levels. So we can use urease in bathrotes to measure urea concentration in blood. We are using enzymes like cholesterol esterase and oxidases to measure total cholesterol in blood. We can use reagents like glycerokinase to measure triglycerides, and also enzyme like uricase to measure uric acid in blood. That's how we can use enzymes as reagents in the laboratory to measure different concentration of analytes using enzymes. Then the third application of enzyme is treatment. We can also use these enzymes in treatment of diseases, therapeutic use. Number 3 is therapeutic, or you can call it treatment. Treatment of diseases. As I always remind you, please subscribe. As you're watching this video and you haven't subscribed to our channel, please make sure you subscribe, like and share your comments. I shall always reply. So as we look at the therapeutic use of enzymes, we see enzymes like trypsin, enzymes like chymotrypsin, enzyme like hyaluronidase, enzyme. We see enzymes like streptokinase. These enzymes are being used in the treatment of diseases. For example, trypsin is used, trypsin and chymotrypsin, they are used in cleaning of wounds. Whenever a patient has a wound which is infected with different bacteria, we know that these trypsin are proteases. So they break down the protein part of the bacteria. So whenever the wound is infected with different pathogens, so we put trypsin, and trypsin begin hydrolyzing this protein part of the pathogen, leading to its death. So we can use them in the cleaning of wounds. We can use enzyme like hyaluronidase in drug. You know, whenever we are giving drugs, some drugs do not penetrate well into the blood, into the tissues. So we need an enzyme which can go fast to break down, to ease the way for the drugs. So we can give a drug like IM, whenever I'm giving like an IM drug, that is intramuscular, I can combine it with an enzyme hyaluronidase. This hyaluronidase goes and dissolves the ligaments and other body tissues so that it creates a way for the drug to be absorbed 100%. So I can give you a drug together with hyaluronidase so that this hyaluronidase goes breaking the tissue to ease entry of the drug. Then another enzyme we are applying in the treatment is streptokinase. And this streptokinase enzyme, which is derived from group B streptococcus, what we call beta hemolytic streptococci, that this streptokinase is used in people with thrombosis. Thrombosis, that is blood clot, and people with emboli, or what we call embolism. A thrombus is a clot that is still attached on the blood vessel. But once this thrombus starts moving in the blood circulation, it is called an emboli. And those clots are always cleared by giving streptokinase. You can use either streptokinase or you can give your patient urokinase. It is also an enzyme. These two enzymes, this urokinase is got from urine. Or sometimes even it is naturally in our body, present in our body. But in case it is deficient, we can give you urokinase or streptokinase to break down the clots in the body, especially to people with thrombosis, what we call DVT, deep vein thrombosis. We can treat them using streptokinase. Thank you so much for listening. We have seen application of these enzymes in medicine, whereby we have seen how they are used in diagnosis of diseases, how we use them as therapeutic agents, that is in treatment of diseases, and also how we use them as reagents in the laboratory. Thank you so much for listening. This is Muhumuza Naphtali, medicalscience.com. See you next time.